Okay. Good morning, everyone. I will call the meeting of the neighbors of Dunn County to order. Let the roll call show that we are all here along with various members of staff and Chairman Bartlett. Do we have any public comment? Carmen, you're nothing? Okay. We'll get right into your administrator's report, please.
Right. Thank you.
Oh, I'm sorry. I skipped that. Thank you, Mr. Vice Chair. We've all had a chance to read the minutes. Is there a motion to approve? Might there be a second? Motion made by Supervisor Kinnear, seconded by Supervisor Jensen. Is there any questions on the minutes? Hearing none, all those in favor of approving, say aye. Opposed? Carried. Sorry about that. No public comment. Okay, go ahead.
All right. Thank you. As always, we went over our quality assurance steering committee. We did not have anything substantial to report this month. We went over our corporate compliance report. So we do that every quarter. We go over that. There was no concerns. We always look over all of our billing during corporate compliance, as well as any audits from Medicare or anything like that. And we did not have any issues to report this quarter. That was the majority of the meeting. So we did not have anything substantial to report to this committee from the Quality Assurance Steering Committee. Any questions on that? All right, next is the employment activity report. So I will have Chris go ahead with that.
Morning.
Good morning.
So the report went out yesterday when I got financials and whatnot available. So kind of the highlights of the employment report for February is we had 4 new hires. I had 5 people leave. The various reasons are listed there. When we go down to open positions, obviously those were adjusted with the activity for employment for hires and people leaving. Go down to leaves of absence. You're going to notice that looks a little bit different this time around. I just did it as a number of employees. So like not if we have like a one-off employee that's on a leave, they're not kind of singled out on this report. So current active leaves of absences, I have 22 employees with an active leave of absence. Go down to work comp lost hours, nothing for the month of February. Go down to in the red for COVID missed shifts for COVID-19 issues like an exposure or, you know, they had a symptom that could be COVID. So that was 50 missed shifts, or roughly 500 hours. That does include, I threw the agency staff into these total numbers too, since they would have to be replaced just as anybody else. So that's why it's not 10-hour shifts. If you just did the simple math, it's a mix of 8s and 10s and 12s that got us up to that 500-hour mark of missed shifts due to COVID related issues. Do you have any questions on the report?
Go ahead, Mike.
Thank you very much. Thanks, Chris. It's kind of a question for you and Carmen. We hired the PM workers, and we're hoping that we'd be able to keep CNAs. And I noticed there's even more shifts that we had to fill, open positions this time. It's gone up, you know, each month it's been going up, 52.9, 53.7, 54.9, looking at the CNAs. Those are open shifts, right? Or open positions?
Open positions.
Yeah, is that just an anomaly, or is there a reason why we're having more and more open CNA positions?
I think it's just a continuation of the issues that we've been seeing. So ongoing with different reasons for leaving, as above, Chris, or as you can see above, Chris listed the different reasons for leaving. We haven't seen as many burnout reasons for leaving. It's more just, we had a couple people just not show up to work, things like that. We have seen a benefit from the PM homemakers. I can't directly tie it necessarily to number of people leaving, because people don't always tell us or things like that, especially when people don't show up. But we haven't had as many concerns or complaints from staff about the PM shift. So that we do think that there was a benefit to our CNAs on PMs, as well as in terms of resident satisfaction and care on PMs has increased as well. And we did know that actually was something from the Quality Assurance Steering Committee this past month, that we were talking about falls, and our falls have also decreased on PMs. We can't directly relate that. It might be a coincidence, but we do think that that has something to do with it, as there's more time for the CNAs to be helping the residents versus cooking dinner and things like that.
Well, yeah, if you get a bunch of these kind of things,
Mhm.
then it'd be a nice indication. So,
Mhm.
yeah, I was curious about that.
Sure.
And I could ask now, I suppose. I can wait till the next one. We've got 99 people now it looks like, can we still cover without
Mhm.
taxing people?
Yes.
I'm going to ask that every time when we go up.
Yep. I was ready for that one. So yes, this month we had 99. Today we have 96. As of this morning, we had a few deaths, discharges in and out. We've been keeping right around the high 90s. We did reach 100 a couple of days, but we still do have the 2 households closed. So we have kept it at that level at this time. So we're not admitting past what we can currently staff. There are days that we probably could have other households open, but it's not consistently there enough to admit people, because we can't admit them for a day and then send them back the next day. So we do have times where we do have enough staff to have more households open or have a couple more admissions, but it's not consistent enough at this point. So we have kept it at that level.
Good. I'd like to see you keep it at the level so you
Mhm.
don't burn people out in the long term. Keep your employees
Mhm.
better. Yeah.
Yep. And I can add a couple other things on that report as well. When you see the COVID numbers, those were a little bit higher this month than a past couple of months. That is partly due to the outbreak we had in the East building. We did have 5 positive residents, which I'll get down to later. I know we've talked about the past couple of months, but that does include some staff that we believe were in correlation to that outbreak. We did see more staff test positive during that time frame. And when you test positive, you have more days off and more shifts missed than if, say, you had a symptom and test negative. You're just off until you have your test results back. So that number is higher this month because we did have quite a few more actual positive staff members compared to just having people tested. So that number is higher, as well as I wanted to give an update on the CNA training course that we've had conversations about. So I believe last month and the month before, we discussed that we have been working with a company that does online CNA training. That's kind of like chartered through us basically, and they do their clinicals with us. We actually have a meeting with that company tomorrow. Paula and I do, to discuss further with that and hopefully get the next step in the process. The hard part of that is it still does need to be approved by the state, just like a regular training program does, which we are eligible for per our regulations and survey history and things like that. It does need to be approved. This is a new thing. I do know there was one nursing home in our local area that did get approved through this process, so it is doable. So we should have more updates on that next month, since we will be meeting with them tomorrow. Any other questions on employment at all? It's not read yet, Dave. You have to press the right side. You want to
Just
try
push it
this
once.
one?
Just push it and Nope, doesn't like you.
Well, my question is, before we accepted, were they agency people or not?
Where are we looking right now?
The positions offered, accepted, interviewed.
Chris, do you have an answer for that question? Oh, sorry,
didn't
you
hear.
probably can't hear. Dave asked if the 4 positions that were accepted were agency or our staff.
Our staff was accepted at 4 for direct hire and then 4 agency staff.
So 4 of each.
Yes.
I apologize. We are having mic difficulties.
Oh. Did you hear the answer, Dave?
Yeah, it's four of our own,
Correct.
which is good.
Mhm.
And any other questions for employment report? All right, I will move on to resident referral report. All right. So at the first of the month, we had 94 residents in-house. We had 132 referrals. As we've seen in the past few months, this has been fairly consistently high. Just as we've been talking about, there are very few nursing homes accepting for various reasons, both COVID as well as staffing. So this number keeps consistently high due to more referrals needing places to go from further out, as well as less people accepting. We had 11 residents admitted to the neighbors this month. 2 of our referrals are still in the hospital, or were still in the hospital at the end of February, so it was a little bit higher, or for not admitted. So we had 11 accepted, which we've been consistently filling the beds that we have available without keeping or without opening Arrowhead or Fireside. So that has been what we just talked about, and we've been consistently doing that, as well as we have had some people go out to the hospital and come back. So that's why that number is a little bit higher than normal, because we did have quite a few people go out, have a stay in the hospital overnight. So if they stay over a midnight time frame, even if they're only there a couple of hours, it's considered a discharge and a readmit. So just for billing purposes. So that is why that number is a little bit higher. We had 99 residents in the facility at the end of the month, which now we're at 96, as I mentioned earlier. So we're kind of staying right in that high 90s range. We had 0 residents transferred to another facility. This month, we only had 1 death, but at the end, after February into the first week of March, we had quite a few deaths. And then we had 1 discharge home after a short-term stay. Our referral sources are still our 3 major ones. We have Sacred Heart, Mayo in Rochester, Mayo in Menominee, and then also Mayo Eau Claire Luther Hospital is also always one of our major referral sources. But as I said, we also are getting some from further out hospitals due to facilities not admitting. Any questions about referrals or admissions?
Yeah, I have one, Carmen. I would imagine the 11 residents that were admitted were on a first come, first served basis. Is that how you do it? Or, you know,
Sure.
they sign up and
Sure. It kind of depends on the situation. So a lot of those 11 were already our residents, so
Oh,
they would
okay.
take precedent first. So we'll always have someone readmitted if we send them out to the hospital, unless their care needs change to the point that we can't take care of them. We will always take them back. If the other people is typically if we have a room available. So if someone needs a room today, and we don't have a room available, but we have a room available tomorrow, we'll talk to the hospital and say, can they wait a day? If they can, great, they can come to us. If they can't, they might go somewhere else. So it kind of depends on the situation. In terms of long-term care, we do have people on a quote unquote waiting list, that people that know their family might need care say in a couple of months, they'll call us and say, we're not quite ready yet, but we want to know the process. So then we put them on a list. And if we do have an opening, we then call that list, start from the top, basically first come, first serve off of that list, and just call down the list and say, we have a room available. Are you interested? If they're not, we go to the next person. That's especially happens in our memory care units because those have typically been full. And since we only have 2 households that are memory care, those fill up fast and they're always something that people would like. So that is somewhere that we always call to see and if someone is ready to be admitted.
Yeah.
Is there any preference or priority given to Dunn County residents?
If we have admission that if we have multiple admissions coming or referrals coming in the same day, that can be a factor. If everything else is the same, payer source is the same, care needs are the same, acuity is the same, that would be something that we would look at and say we'd take a Dunn County person first. We don't only admit Dunn County people, but it is someone that is kind of a factor we look at to take up someone from Dunn County over someone from somewhere else.
I know this sounds kind of cold, but say 5 go into the hospital and their beds are held for them.
Mhm.
Do they still pay for them that time?
It depends on their payer source. So we have something called a bed hold. It is a different rate, as well as Medicaid pays a bed hold for a short period of time, depending on how long they're out for, and it is a different rate. And then VA also pays a bed hold, but that's only for a couple of days. So it depends on the payer source, whether or not they have a bed hold. So we do charge it to private pay residents. It is a different rate, basically saying you're paying to reserve your bed. So that's why sometimes if someone's private pay, they don't reserve the bed. So it kind of depends on the situation.
Okay, well, if a veteran goes in for a week and it's only 2 days, then who covers that?
So it would be covered by VA for those first couple of days, then we wouldn't have the bed hold. So technically
okay.
speaking, someone else could be admitted to that
Okay,
room. We
okay.
don't typically do that, but it could happen.
Okay, thanks.
Brian,
Steve.
so referrals, you could say that there's private referrals too?
I'm not really understanding the question.
Like a resident?
Yep.
People that are living at home
Mhm.
can make a referral also?
Yep, so
Family
they can call
referral?
us, they can call us and say, we have a loved one that we want to come into the facility. Those would either be private pay residents or Medicaid, or they could be VA. So most of the time our referrals come from the hospitals. And those are people that either are in the hospital and need a short-term stay with us, or they're in the hospital and know that they can't go back home. They're not able to go home or to assisted living. So they might need to come to us long-term, but we do on occasion have families call and say, we're just not able to take care of mom anymore, or she's not safe at home. Do you have a bed available? And then we would go through that process. We do need a doctor's order and things like that, but that's a fairly simple process to get taken care of with people.
Okay.
Any other questions? All right. We will move on to the environmental report if Scott would like to do that.
Good morning, everyone. As far as environmentals and facilities report, I don't have a huge amount. Just want to report that our enunciator panel for the central building is on order, and the company is working on the state submittal on that so that we can get in compliance from our survey, our federal survey. Things seem to be working good with the heating system. Of course, it helps out that it's warming up and getting better out there. It seems like we've been having less problems with the nurse call system since they replaced the server and got that taken care of. So hopefully that'll continue and less problems with that. Otherwise, everything is going fairly smooth, I think. So that is all.
Good. Questions? No. Thanks, Scott.
All right, next is a fundraising update. So I thought I'd add this to this since we have been doing a lot of fundraising lately, and just give a brief update on that. The primary purpose of our fundraising is for a new bus. It has been something that has been originally put in the budget almost every year, and has been cut due to needing to make cuts. I know it is also in the capital improvement budget for next year, and we are still hoping to keep it in there because our fundraising is going very well, but buses are very expensive. So we can have 1,000 bake sales and we wouldn't get quite to there, that number. But we are making different efforts as well for grants and things like that, to even if we do have it in the budget, that maybe we can subsidize some of that with more fundraising efforts and things like that. So I just want to give an update. So far, we have done a handful of different fundraisers. Our biggest one was our 5K race in the fall, which turned out to be a virtual 5K race, which the race itself didn't raise that much money, but different things we did along with it did. So we went through the process of being a raffle licensure. And so we did a big basket raffle, and that brought in quite a bit of money, as well as a few other things along with that for sales for fundraising stuff with sponsors and things like that from local businesses, which we're very grateful for. And we've also done a couple of luncheon sales. Yesterday was one of them, and we also did a taco sale a month ago or so. And we do plan on continuing to do that probably once a month with a different meal. It's definitely our biggest contributor to our fundraising efforts, and everybody loves them. I think people miss the bistro very much, and this is a glimpse of the bistro. So we do get a lot of people from our community coming in, especially the businesses right around, the neighbors, as well as people from the government center coming over. So in total, thus far, we have raised about $16,000 since we started doing fundraising for this. So we're very happy with that, and we're hoping, and that does not include yesterday's fundraiser. So we're not sure exactly how much we made yesterday yet. We haven't added all of that up and taken out the expense of obviously the food product. So we're hoping to be right around $1,000 from yesterday. So that'll be up closer to that $17,000 mark. So slowly but surely, we're getting closer and closer to our new bus. We also have applied for a couple of grants. We did a community foundation grant. That grant doesn't do quite this large of projects. They're typically somewhere, I believe they said below $5,000. But if they had a grant to give us $5,000 towards the bus, that would still be helpful to add on to our total. So we submitted that grant probably about a month ago, and it's still pending. So we're waiting to hear back from them, as well as we have looked into a couple DOT grants. We've worked with our transit folks to try to help us with grants that they've done in the past as well. So I believe that grant is due at the end of the summer. So you'll be hearing more about that, because I do believe to process that grant, it requires county board approval. So we will be going through that process probably the May-June timeframe. I believe it's due in August or September. So any questions about fundraising at all?
Yes, if you might. I was wondering, you were talking about having discussed with transit a bit. I was wondering if there might be extra federal dollars for an electric bus around, because I know that they have been doing some grant with 80/20 money for the electric. That's why we're getting 2 plus probably 2 more for transit. So it might be worth looking specifically into
Sure.
an electric bus.
Sure, we can definitely do that. I know we actually did talk with transit about maybe repurposing their older buses, which would be great compared to the one we have right now. The only difficulty is that they aren't quite as handicap accessible as ours. So it depends on how many wheelchair spots they have in them. So ours has more wheelchair spots than regular seats, and most of their buses have more seats with a couple of wheelchair spots. So we have very few residents that are capable of getting into an actual seat without having assistance. And we typically don't send nursing staff along with to activities. So our activity staff can't transfer people. So that's kind of our hard part with that. But I don't know if the electric buses, they make them like that. I'm not sure. So we'll look into it.
Well, I'm sure they will.
Yeah, they have a variety of configurations.
Sure.
You might also, if you did get one of the old transit buses, you might be able to use grant money to reconfigure the
Sure.
seats because they're modular.
Okay. Thank you. I will look into that and we'll talk with transit as well because they've been very helpful with helping us navigate the grant process through transit because it's much different than our regular grant processes. So thank you. All right. Any other questions about fundraising? All right. And then my last part of my report is the COVID-19 updates. So as I mentioned a little bit earlier, we did have an outbreak in the East Building, and I think we talked about that a little bit last month. We were kind of in the midst of it. So that has cleared. We are completely out of outbreak. It's been closer to 21 days since our last positive case, but we are past the 14 days that would consider us an outbreak. We ended up having 5 positive residents and a few positive staff that we can assume were connected to the outbreak, but not necessarily conclude they were, as obviously they go out into the world as well. So we had a few positives, no severe illness, which is a benefit. And some of our positives were vaccinated and some were not. So it is a testament to the changing in variances that we are not seeing as severe of illness as we had, say, 2 Novembers ago when we had severe outbreaks. So we're very fortunate that we did not have any severe illness, no deaths, anything like that. And we had cleared that outbreak pretty quickly, as well as without having a mass outbreak. And it did stay in one household, which is a benefit as well compared to the last time when it stayed in one neighborhood, but we had 3 households that all had positive cases. So we are very happy that that went smoother this time.
Good news.
The only other COVID update I have is that in case there's questions about it, I know that the regulations for general public have changed multiple times in the last couple of weeks. The regulations for nursing homes really haven't changed much. So we're still wearing masks in the facility. It's still required of visitors to wear masks. We still have to check people in. We still do testing of staff if they're not fully vaccinated and up to date, which means if they're eligible for a booster, they must have the booster. Otherwise, they have to be tested. We still have the vaccine mandate, all of those things. So I know that that's the first question we get is if it changes in the greater community, did it change at the neighbors? And as of yet, it has not. So in case your constituents are asking you, it has not changed. So we still have to do all of those processes.
Is staff up to 80% vaccinated yet, you think?
Yes.
Good.
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 Can
Yeah.
I'll ask you a question that I asked earlier, as far as entertainment groups coming in,
Mhm.
like a ukulele group or it's not Death's Door singers, it's threshold singers,
Mhm.
things like that. Are they allowed to come in now?
So we have had some people come in. We do have to have anyone that's providing a service at the neighbors has to be vaccinated. So that is one of the holdups. We did have a couple of groups call and ask, and we had to say, you can't come in if you're vaccinated. The only thing that we haven't done yet is singing groups, since singing is a way that COVID is spread easily, as well as it's a little bit hard to sing with a mask on, and they do still have to wear masks. So we have had people come into the chapel and sing in the chapel, and they can have their mask off. We can have them sing, and then it's broadcasted out to the rooms. So that's been kind of our compromise with that. But things that you wouldn't have to sing, like a ukulele player, that would be okay as long as everybody is vaccinated. So that is one of the differences is that it's not only staff, it's anyone providing a service. So visitors, don't have to be required to be vaccinated, but anyone doing a service. So as far as even like our pest control, we have to make sure they're vaccinated, or anyone delivering things, if they come in the building, they have to be vaccinated.
Oh.
Mhm.
We've talked about vaccinated. Can I digress just a little bit?
Sure.
Do you foresee a booster coming up for residents?
There was talk about it. I do know that in Europe and I believe Israel, they had a third or a fourth shot that came out. It has not been discussed yet at our level. We haven't heard of anything coming out for us. It kind of goes back and forth on, is it going to be an annual thing? Is it going to be every 6 months? So thus far, there hasn't been word that we're going to be doing that anytime soon. It's just kind of been talked about that other places have.
Thank you.
Any other COVID related questions? Okay, that concludes my report.
Thank you, Carmen. We're now on to number 6, review of the vouchers. Are there any questions on the vouchers? I did see one where you had a check for $1 for a cell phone. I don't understand what that would have been, but it's no big deal, but yeah. But $1.
I believe that has to do with the activities cell phone. We have a cell phone that the activity bus takes, or if they take the bus out, they always have a cell phone with them, just in case there was an emergency or anything. And I believe that the bill for the month, every month, is $1.
Okay. Well, that's all right. I'll have to get on that. So now we're up to financials. Good morning, Jane.
Good morning. Happy St. Patrick's Day to everybody. In my report, the way it came out of my printer, if your first page is the aging report. I tried another new format this month and realizing that we missed the January numbers last month, I included both. And to highlight the total outstanding balance is what we want to look at there. In January, the total outstanding balance was $1,100,000. And then at the end of February, the total outstanding is $1,166,000. So it was a little higher at the end of February. And census was going up a little bit, so that may have been front loaded on the items that we had just billed. So, any questions on the aging? Okay. The next sheet, the paid pool staff report. It is not looking, excuse me, not looking real good. If we look at the February numbers, the total campus charge for agency was $308,000. And that, if we look to the next page of the income statement, that's half of the nursing budget for the month. So the agency staff is a half of what is budgeted or what our expenses were. So that is significant. Our average monthly, I know it's just 2 months, but the average is $235,000. And in 21, we thought it was bad, and it was $144,000 per month average. So it's getting expensive because they are charging higher rates after COVID now, and that's the fact there. Any questions on the agency staff expenses?
Well, you just mentioned they're charging higher rates after COVID.
Well, continuing, I guess.
Because of COVID. Yeah, okay.
Yep.
It's, if I can, it's primarily due to just the need of staff is, it's just pushing up the rate because everywhere needs staff so bad, they know that everyone will pay it.
Yep. Okay, and then onto the income statement. And the average daily census was 95. And we had budgeted 119. So with those 2 units closed in Central, it does impact the budget significantly. If we go to the total revenue of the year to date is $479,000 less than budgeted. So we're down at least pretty much almost $500,000 right out of the gate here. So that's not great, but if we don't have any staff, we just can't take people. So our business is changing. The senior meals was not posted to the revenue when I ran the report, so we can add probably another $12,000 in there for revenue for the month. Under expenses, again, if we look at that $308,000 compared to the $718,000 that was spent for nursing services, that's a big portion of that. So that's what I'm concerned with, but we can't do anything about that. The rest of the expenses are pretty much in line with what we expect. So if we're $479,000 less in revenue and we have expenses less 401,000 compared to budget, it looks like we're kind of holding our own here. And then if you put the $200,000 of loss, excuse me, if we put the $113,000 of depreciation that is not quite posted, we're just down like $100,000. Still not in the black, but hopefully, you know, we'll have a good summer and we'll get more staff and get more residents and we'll be on our way. And there's no COVID money put into this because we're not posting that on a monthly basis. There might be up to $300,000 at the end of the year when it's time to reconcile the COVID expenses. Any questions on the financials?
That 300,000 isn't a lock though, huh? Could be zero.
Well, we have it. We have the money.
Yeah.
I'm pretty sure that we'll be using it
Oh,
for our. We are still tracking COVID expenses and lost revenue.
okay.
It's not a lot to count on. Last year we had over $1 million.
Yeah.
That was reimbursed for our lost revenue and other COVID expenses.
Yeah, the primary use of COVID expenses right now, or what we could bill it back to, is lost revenue as well as the staffing, the extra needed staff due to people being out for COVID. We don't have as much of actual day-to-day operational expenses like extra PPE and things like that. We don't have as many purchases that are related to COVID anymore. It's more lost revenue, increase of cost for food is another one, and then staffing coverage.
Yeah.
Thank you.
Any other questions?
I have a question.
Go ahead. Steve has a
I
question.
was wondering if with inflation and that in the last year, if that's affected every one of the expenses, or if you see it, that it hasn't affected everything.
Insurance and the overhead costs aren't too drastically increased. Our health insurance costs didn't go up terribly. So that's, we're able to keep that static. Carmen, any other items or expenses that you can comment on?
The biggest one that we see a huge increase on is food. Food has been extremely expensive, just like it is in the grocery stores. Especially meat products are very, very expensive. We've been doing our best to try to find deals and different ways to do cut costs, but with still keeping quality, because we want to keep the quality of food. That's definitely something that residents look for. People coming to the neighbors will look for things like that. So kind of balancing cost savings while still making it good food for our people. Other items such as masks, PPE, stuff like that are still at the higher costs that they were at the beginning of the pandemic. That really hasn't changed. It was the pandemic started, everybody knew we needed all those things, jack the cost up super high, and then it stayed there. So those are more expensive, as well as some just general items are more expensive, like shampoo and other things that we supply to our residents. Those would marginally have gone up as well with inflation.
So a lot of the services then have stayed basically the same as a year ago.
Can you give me an example of what kind of
Like,
services?
Like pharmaceutical stuff or somebody coming in and spraying pesticides or
Sure.
whatever they gotta do.
Most of that stuff is on contracts. So we do have contracts with with the companies. I don't know if any of Scott's contracts have changed at all, but most of those are things that we have long-term contracts with different companies. So they would not have changed with the inflation. Doesn't mean that they couldn't if they issued us a notice that they were going to change the cost of things. But thus far, we haven't seen terrible increases with anything for our contracted services. So the cost of medications is one that could go up, I guess. That is based on whatever the medication that the resident would need. So our pharmacy contract for our pharmacist hasn't changed, but the medications themselves could have gone up if it's something that we have to cover. I don't know the answer if that actually has or not, but the cost of the pharmacist hasn't changed.
You have anything else to add, Jane?
I don't have anything else to add.
Anybody have any other questions for Jane? And hearing none, is there a motion to approve the vouchers in the financial report? Is there a second? We have a motion and a second. Is there any other questions? Hearing none, all those in favor say aye.
Aye.
Opposed? Carried. Well, that kind of looks like that takes care of it. Anybody have anything else at all?
Hey, Brian, who made the motions on that? I didn't
I'm
quite
sorry,
see it.
Kelly moved and Mike second.
Okay, thanks much.
Sorry about that.
That's good.
Okay, hearing nothing else, we are adjourned.
I will stop the recording.